All right, we'll go ahead and get started. Hi, my name's Matt Winter. I'm the Chief Veterinary Medical Officer for VetCT, and I just wanted to welcome you to the latest of VetCT's 12-minute take-home webinars. It's really great to see so many people here, and we really enjoy having everyone stop in and see us. As you probably know, VetCT recently launched our new app and teleconsulting service, and we'd love for you guys to give it a try. Through the app, vets get instant access to a team of our friendly specialists who offer support and advice for tricky cases. And you can choose to communicate with them via a multitude of different channels. You can do an instant callback, text chat, book an appointment at a time that suits your schedule, or receive a written report. We've now made it really easy for you to interact. It's like having a specialist on speed dial. Just ring through via the app and our team will help create a case and get you in touch with the specialist. And then you'll also learn on each of the cases. And anyone who's in the UK will get the added benefit of some real-time CPD. So if you want to try this, just download the app from the App Store or Google Play. And if you scan the QR code on the screen, actually it's not on right now, but it will be on again at the end of the talk. You can also use that to take you directly to the app. This is beneficial for both employed and locum vets, and we'd be happy to discuss it more with you. Just go to our website or contact sales@vetct.com for more information. All right, without further ado, let's get on to today's 12-minute webinar. As a reminder, this session is being recorded and there will be an opportunity to ask questions at the end. So please do add any questions into the Q&A section of the webinar, not the chat box. We'll answer as many as we have time for, and we'll follow up with any others that we can't get through after the webinar. With that, I'd like to introduce you to Dr. David Gould, who's the leader of the ophthalmology team, and he'll be presenting today's talk. And you can see from his bio that's been up on the screen that he's been a very busy and well-accomplished ophthalmologist in veterinary medicine, making very exceptional contributions to the profession and the specialty. I'm going to introduce you to David, and today's session is entitled Iris Darkening in Cats, Benign Melanosis or Malignant Melanoma.
Great, thank you, Matt. Hello, everyone. So I worked at Davies Vet Specialists in the UK for about 17 years. I've actually left there in the last year and now based in the Netherlands. Anyway, this was quite a popular request, and it is something that we had a lot of emails, referrals about all the time. I was at Davies and before at Bristol, and I get it a lot in the Netherlands too. So big question. These dark irises in cats, are they melanosis or are they something more sinister in the form of a melanoma? So a little background before we kick off with that. So you may well be aware that iris melanoma is the most common intraocular tumour in dogs and in cats. The presentation between the two species is significantly different, and this is a really important thing to remember. In dogs, well, basically, it's pretty simple in dogs. I'm not only going to spend a few seconds just reminding you of that. So bottom left here, you'll see a picture of a typical iris melanoma in a dog. And the key things about this, they're quite easy to recognize, okay? So the rays, the focal, they're usually darkly pigmented, and they there's not many differential diagnoses for this. Iris cysts are sometimes confused for them, but they're quite different. They tend to be spherical, free-floating, less pigmented, and so on. So they're fairly easy to diagnose. Good news with canine melanomas of the iris, they're benign. They may be locally invasive, but they're not going to shorten the life of the dog. They don't metastasize. They may be locally invasive and cause problems over months or years, such as glaucoma. So monitoring of these is justified, but we don't need to do anything about them unless they develop secondary painful and sight-threatening complications. Cats, on the other hand, it is a much more tricky interpretation. And there's a photo here on the right, and this is what turned out to be a feline diffuse iris melanoma. And you can see the difference between the presentation in cats versus dogs. So they tend to be, it's very unusual to get raised melanomas in cats. It can happen, but they usually tend to be flat. They usually tend to infiltrate the iris stroma, and they tend to be diffuse. You even can get multiple foci dotted across the iris. The main concern about these is they do have metastatic potential. Okay, and that's really the whole concern about this. So we tend to term them Feline Diffuse Iris Melanoma, or FDIM, you may see them referred to. Metastatic rate, well, the biggest study for a long time was by Pigment and Mooney, and they showed a 63% metastatic rate. A more recent study in 2016 by Wiggins, I think it was, showed closer to 20% metastatic rate, but nonetheless, still significant if you're the owner of a cat with a dark iris, 1 in 5 chance to 2/3 chance of it becoming malignant and leading to fatal consequences. So that's a key concern. What makes it even more complicated, as I mentioned just before, the main differential diagnosis is benign iris melanosis, which is basically just freckling of the iris. So this is of no concern. It's not going to affect the sight or life of the patient. And that's the big concern. So here's a photo on the left here of a benign, or what I presume to be a benign iris melanosis. And as you can see over time, this is a couple of years, a year or so between, you get this gradual progression, not hugely obvious in this case, but you can see up here, more darkening than previously, slightly infiltrative, or something not infiltrative, expansive pigmentation, and that's about it. So these are the questions. What do you do with these kind of cases? Okay, the only way to definitively diagnose melanoma is by histopathology. And although we can do iris biopsies in cats, and I'll mention them very briefly at the end, that for the vast majority of cases, that's not practical. It's not going to be what we're going to be doing. So the choice is either enucleate or not. So that's the big concern. It will take a brave vet, but arguably a foolish vet, to enucleate an eye looking like this. So what we look for are really clinical markers of iris melanoma. And thankfully, we do have those. Okay, and that's really the rest of my talk is just going to be clicking through those major clinical markers that point towards melanoma and away from melanosis. Okay, they're not definitive, but they're good guidelines, good indicators of whether we've got something to worry about. So this is the list. You'll see this throughout the next few slides, and we'll go through them just one by one over the next few minutes. So number one is this, a thickening of the iris stroma, or what we describe as a kind of loss of architecture. Now, if you look at a normal feline iris, well, look in the mirror, look at a normal your own iris, you'll see it's not flat. We've got these peaks, we've got these troughs of connective tissue and blood vessels as well. So you get these raised areas, these crypts, these valleys, these hills, and it's quite a beautiful structure. Okay, and that's a normal iris. With melanosis, that structure will remain. Okay, it'll become pigmented, but you'll still see this normal architecture. In contrast, melanoma can lead to a loss of that. Not all cases, but you'll sometimes get a thickening of it as the tumor cells infiltrate the iris stroma. Okay, and then you lose these. And in this image here, you can see quite clearly, I think, a loss of the detail of the iris. And this is what we describe. If you have a slit lamp, by the way, this is really useful to use in these cases. Okay. Similarly, this is a term that's used quite a lot, often in the States, actually, velveting. And this is also just thickening or loss of architecture of the iris, which again, we'll see in melanoma, less likely, we don't see this in melanosis. So it's described as kind of velvet kind of appearance over the surface. Again, if you look at that image, there's a loss of iris architecture there. Okay, it just doesn't look particularly nice. So that's an indicator that we may be dealing with melanoma. Pigment shedding. Now, this is a real concern if you see that. Thankfully, this is pretty rare. So most feline diffuse iris melanomas don't shed pigment, but if they do, it's a major cause for concern. In this photo, I don't have many photos of this, but this is a nice one taken by my ex-colleague Georgina when she was my resident at Davies. She's now at Dick White's. And really nice photo of her here. So you can see the iris melanoma in the background, slightly out of focus, because we've focused on the cornea, and we'll see these pigment spots here on the inner aspect of the cornea, on the corneal endothelium. And these are clumps of malignant melanocytes. So major concern in these cases. And of course, you wouldn't get that with an iris freckle, okay, with melanosis. Okay. Third clinical marker, little bit harder to determine, perhaps, if you're not, if you don't have an ophthalmology colleague nearby, but it is something you can certainly look for, and that's invasion of the drainage angle, okay, where the aqueous humor drains through into the systemic circulation. Now, in dogs, to examine the drainage angle, you need a technique called gonioscopy, but in cats, you can visualize it directly if you have a strong light source and magnification. So again, a slit lamp is ideal. So you don't necessarily need gonioscopy in cats. So here's a photo of a cat I was just about to enucleate, and I've just pulled the third eyelid across so you can see this invasion of the drainage angle, or the peripheral iris, should I say, in this case, heading towards the drainage angle. And if you do gonioscopic examination, either direct with magnification or with a gonio lens, if you have one, you'll see this change. So here is a normal drainage angle. So I'm just going to mark you can see the pupil, you can see the iris, and then you can see the pectinate fibers spanning the drainage angle. This is normal. And in this case, this cat with a tumor, we've got the pectinate fibers are obscured by melanosis, or melanocytic appearance, and these are malignant melanocytes. So again, you wouldn't see that in melanosis, and if you see it in FDIM or suspected FDIM, then yes, absolutely cause for concern. These guys are heading out the eye and into the systemic circulation. Okay. Okay, now I think this is the easiest thing for you to determine in practice, and actually, I think arguably the most useful. So something to take note of. And this is just distortion of the pupil, or dyschorhea, or difference in pupil size between the two eyes, so anisocoria. And you can see here, we've got this change in pupil shape on the right eye, where there's darkening. And what's happening here, these malignant cells are infiltrating the iris stroma, they're infiltrating the dilator and constrictor muscles, and they're inhibiting their function. So we get abnormal pupil shape in this case. And again, this is not something you would see at all in benign melanosis. It's sometimes not as obvious as that last slide. And here's one that's a little bit more subtle, but if you look carefully in these cases, and again, if you have some magnification, very helpful. So this is a case, you can see this diffuse iris pigmentation, and down here, so that in itself is some concern, but you can't really differentiate that from melanosis. But if you look at the pupil margin here, can you see this area here? So this is ectropion uvei. What's happening? The pupil is being pulled, everted, due to these malignant cells invading. Secondary fibrosis is developing, and we're getting a distortion of the pupil margin. It's quite subtle, but it's there. Again, if I see that, I really start worrying. Just an example, really useful, by the way, to monitor by taking photos at your checkups, whether they're 6 monthly, 3 monthly, yearly, whatever. And this is a cat that I was following for many years, actually, just with some pigmentation. The owner was a very sensible lady, just following it with regular checkups with me every 6 or 12 months. And I used to take photos for my own monitoring as much as anything. And at one of the checkups in 2018, I suddenly noticed, this is the same eye, I suddenly noticed that as well as this pigment area here, which has expanded here, we've now got some ectropion uvei, okay? Can you see that? It's quite subtle, but if you look carefully, you can see that. Actually, in hindsight, it was perhaps starting a year before, but I wasn't really concerned at the time. So we just didn't do anything there. But here I was concerned. I had a chat with a lady. I said, listen, we don't see this with melanosis. I think it's time to enucleate. We did, and it turned out to be early melanoma. So that's the advantage of this kind of monitoring situation. Okay, and just finally on that one, this is the slide I showed you at the very start, an example of diffuse iris melanoma, and again, this ectropion uvei here, so it's associated with this pigment. Okay, so these are really useful things to look at. Anisocoria, so this cat here has got a dilated pupil relatively to the other eye, and that's because it's developing secondary glaucoma, okay, which is a consequence in some cases. So worth measuring the intraocular pressures in these cases at checkups if you have the ability. Otherwise, if you see signs suggestive of secondary intraocular problems, particularly glaucoma, as you can see in these two, or the bottom one is a severe glaucoma, then again, a major concern. Okay, and then finally, and a bit too late, of course, unfortunately. I know I'm laughing, it's not funny at all. Signs of metastatic spread. So weight loss, lymph node invasion. Now, the local lymph nodes don't always get enlarged because the melanoma is spread by the blood rather than lymphatic. So you may have normal submandibular lymph nodes, but you may get systemic signs of metastatic disease. Okay. And they spread to the liver primarily and the lungs as well. So in summary, what do we do about these cases? Well, like I said, iris biopsy is a possibility. I've done a few of those, but you do need operating microscope. You need, obviously, intraocular experience. You need wet field cautery. It's expensive. It's a referral thing. So it's not a thing that most of us will be doing. So that leaves us with the enucleation versus the watch and wait situation. And as I said, this is what I would generally advise. So we enucleate when you have suggested clinical markers that we talked about, and also when the owner is fully informed. So I do say to the owner, listen, definitive diagnosis is only by histopathology, but your cat's got, dilated pupil, inverted pupil, there's some signs for concern. I think we should enucleate, or do you think we should enucleate? And owners, let owners make the decision. So owners who are quite cautious will tend to go for that. More gung-ho owners may say, let's watch and wait for a little bit. I'm always a bit careful with that. I do take regular photos. I warn them of the risk and get them to sign for it as well. And like I said, we'll enucleate if clinical markers do end up developing. Okay. If you do enucleate, of course, don't just whip the cat in, remove its eye, pop it in the bin and send the cat home. Okay, because 6 months later, a year later, if they develop weight loss and other signs, you've got another differential on your list there. So do some pre-op tumor staging, fairly basic stuff, clinical examination, bloods to check, for example, liver parameters. And then I'll do imaging of the chest and abdomen, so X-ray of both, ultrasonography of the abdomen. If you have a CT scan, perfect. So Davies, we just put these through the CT scan, quick procedure, and then we'll look for any signs of metastatic tumours in those cases. Once you do enucleate, do submit the eye for histopathology, preferably to a lab that's used to ocular histopathology. And what they're looking for is local invasion. So you'll see this histopathology slide here. So this is the sclera, and I've boxed blood vessel here, and we'll see in the right-hand side these brown areas, and these are neoplastic cells infiltrating the blood vessels and on their way out of the eye and into the systemic circulation. So that's a concern. Do ask for them for the mitotic index. So mitotic index of 7 and above is a concern. Some labs don't give you the mitotic index unless you ask for it. So do ask for it, or if they don't give you it, call them up and ask for the mitotic index, and they can do that because that's a good indicator of prognosis. Okay. Right, that is a quick whiz, about 15 minutes, so it's fairly quick whiz through there. But thank you for your attention. I've noticed there's a Q&A there, so I'm just going to click on that and read that. So this is from anonymous attendee. So what examination technique illustrates the pigment shedding or spots best? Yes, so slit lamp ideally. And if you've got a slit lamp that you can then use on a slit beam rather than an open beam, then you'll really see that it's like looking for aqueous flare. It kind of is aqueous flare in some way. So you look at use a slit beam on a slit lamp, angle it slightly, and then you'll see these pigment cells in the anterior chamber, on the cornea. If you don't have a slit lamp, dark room, bright light, focal light source, and kind of look front on, look side on, and you'll maybe see some indication there. Okay. If there's any other questions, then you're welcome. Yes, Charlie, yes. How often do you recommend reviewing cats that you're monitoring? Yeah, a really good question, really good question. I kind of decide on the owner, really. So what I would generally say, once I've seen a case for the first time, I will take photos, I'll discuss the options we've talked about there, watchful waiting versus enucleation. Oh, by the way, I use the term watchful waiting or watch and wait deliberately. It's not the same as benign neglect. You'll hear some ophthalmologists talking about benign neglect. In my opinion, that's a misnomer. Benign neglect means you forget about it until the problem develops. So you're not forgetting about these cases. You're watching and waiting. So watching particularly, so they do need to come for checkups. Okay, so I would typically ask for a checkup, recommend a re-examination at 3 months, and if things haven't changed, 6 months. And at 6 months, I say to them, I recommend every 6 months. Every year might be okay, and it all depends on what the owners want. Most of my clients will go for every 6 months. And the other option, if they're really worried about not keen on doing that, teach them how to take good photos. So use a flash, face, head on, nice to people reflex, and email some photos to me, and I can judge. And if I see anything of concern, I will then call the owners up and say, listen, guys, you need to come in for a checkup for this. Okay. Right. Yes, thank you. Any other questions?
Well, David, thanks. That was absolutely fantastic, and it was really interesting. I want to thank everyone once again for attending, and I hope you found this session really useful. Please do keep an eye out for any future sessions. Next week's webinar is the last webinar in the series, so it's on Wednesday, the 1st of September. I don't know if you can, is there one more slide after that, David?
Sorry, yes, I think so.
So that's the last one. It's going to be on oncology, feline mast cell tumors, because cats are not small dogs. And that's Dr. Kasia Persica. Please do register ahead. And the recording of today's webinar will be available on our website and YouTube very shortly. Also, don't forget to download the app. You can use that QR code that's there at the bottom right of the screen. You can gain quick access to VetCT's team of specialists. We'll leave that screen up for a few more seconds if you want to access that QR code. And if you have any questions, once again, you can access us or ask us any questions directly at sales@vetct.com. Thanks again for spending some time with us today, and we'll see you real soon.